Hello everybody. Mobile phones, tabs and laptops are an integral part of a student's life now, and so also medical students. We use one or many of these devices on a daily basis, and going forward we will be using these devices in our professional life also. Probably the one stage of a medico's life when our device usage increases exponentially is when the NEET PG or INICET exam preparation takes place or the FMGE exam preparation takes place. So I thought of making this short video to help you all to prevent what we call as digital eye strain. So what is digital eye strain? This is something which was earlier labeled as computer vision syndrome. In fact, that is an ICD coded diagnosis. Have you ever felt when you were looking at your laptops or your phones or your tabs after some time just like switching it off and closing your eyes and not do anything for a while? That is probably the manifestation of digital eye strain that you're having. Looking at this from a PG aspirant or FMG aspirant's point of view, you will be using your devices most likely for watching the video classes, recorded classes, for solving the Q banks, for looking at the PYQs. You may be having live online classes or test and discussion classes. You will be attempting what we call as GTs or grand tests. There may be PYQ sessions and strategy videos on YouTube which you might be watching, and you might be just scrolling down and whiling away some time on your devices. I am Dr. Ram Gopal, a full-time ophthalmologist and author of Sure Success Magic, the lifesaver book for PG medical entrance exams. So what are the symptoms of digital eye strain that I come across usually in my clinic? Tiredness of the eyes. This is manifested by patients as I just want to close the device and not have anything to do with it anymore. Blurred vision and focusing difficulty. So patients complain that they are not able to focus very clearly on the screen. The edges of the letters are not very well defined. The letters appear to merge into each other. They complain of a gritty sensation in the eyes or like a foreign body sensation in the eyes, most commonly what we call as a manifestation of dry eyes. Frequent headaches, pressing on the temple area or pressing on the brow area tends to give relief for some people. Watering from the eyes, there is a pooling of tears in the eyes as you're looking at the screen for some time and you tend to wipe your eyes more frequently. And the other common manifestation is a neck pain and shoulder pain. Whenever we are looking at our devices and concentrating, our eyes are constantly accommodating for a near distance. So we can help to relax our eyes by following a simple rule which we call as the 20-20-20 rule. Every 20 minutes, remember to take a break of at least 20 seconds and look at a far distance of at least 20 feet away. By following this simple 20-20-20 rule, we are helping to relax the accommodation and prevent eye strain. What are the other methods by which we can prevent eye strain? Remember to blink more often. Whenever we are studying or concentrating or something on the screen, our blink rate automatically reduces. So whenever you stop blinking or blink infrequently, your eyes tend to become dry. The tear film over your eyes does not get evenly spread and leads to symptoms of eye strain. Wear appropriate power glasses if applicable. That is, if you have any uncorrected refractive errors, wear the appropriate power glasses. That will also help to reduce the eye strain. Avoid reflection from bulbs or from windows which fall onto your screen and cause difficulty in looking at the screen. Adjust your screen settings. I'm sure you should all be aware of your screen settings. Adjust the brightness, use dark mode whenever necessary, and remember to keep a clean screen. We are so interested in studying, we forget to clean our screen also, and a thick layer of dust would have got accumulated on it. For prevention of dry eyes or for treatment of dry eyes, some of the most common lubricant eye drops which we prescribe as ophthalmologists are HPMC or hydroxypropyl methyl cellulose drops, carboxymethyl cellulose drops, or sodium hyaluronate drops. You can use these drops on a SOS basis as required basis, and these can be used even up to 3 to 4 times a day in people with more symptoms of dry eye or eye strain. And last but not the least, remember proper ergonomics, a proper chair, supported elbows, neck relaxed. These are things which will go a long way in preventing your eye strain. I hope you guys found this video useful and will follow these simple but very useful tips to keep your eyes comfortable. Study well guys, all the best.